So today I am going to talk about epidemics in China and Hawaii. I just want to preface my talk by saying that, as we've been going through our current pandemic, the question of the historical context has been so incredibly important. And I did get quite a number of inquiries from journalists and so forth about what the historical experience can tell us about our contemporary pandemic. And a lot of the focus was on the 1918 pandemic, the influenza pandemic, which of course is also a really important historical reference point. But I was also more and more convinced that one of the important kind of historical touch points for us as we go through our current experience was in fact the third plague pandemic, which was a bubonic plague pandemic that occurred in the late 19th century and the early 20th century. So as I begin my presentation, I'll just remind everybody about bubonic plague. Yes, in fact, the bubonic plague, we've gone through 3 bubonic plague pandemics over the past 2,000 years. The first bubonic plague pandemic was the so-called plague of Justinian, which hit primarily the city of Constantinople during the Eastern Roman Empire in the 6th century. That was the first bubonic plague pandemic of the past 2,000 years. And then, of course, there was the second plague pandemic, which I think most people think of as the plague. That was the bubonic plague, which primarily hit Southern and Western Europe in the 14th and 15th centuries, but really there were sporadic plague outbreaks until the 16th and 17th centuries in Europe. And then finally, the third plague pandemic, which hit Asia and also Oceania and here in Hawaii at the turn of the 20th century. And so I've been increasingly interested in looking at these past disease events, these past pandemics, and thinking really about 2 primary questions. First of all, what is the history of public health and pandemics tell us about our current experience today? And then also to think kind of backwards, living through what we're living through now, as historians and people interested in history, how do we maybe have more insight or a greater sense of what it would have been like to live through some of those earlier pandemics around the world, and in particular in places where, we ourselves have our own lived experiences. So the present pandemic of plague, as they wrote about it at the time, so taking us back to the period between about 1896 and about 1911, when the plague was finally brought under control, there was a sense at the time that it had emerged in southwestern China. And of course, it would not be the first or the last case of an infectious disease that was thought to have emerged in southwestern China. Although I hope by the end of my presentation today, I will have perhaps cast some skepticism, some doubt on this narrative of how infectious diseases have emerged in China. I think it's quite a bit of a trope, for example, or even something of a stereotype to link infectious diseases in China, but I can speak more about that towards the end of my presentation today. We don't really have much evidence that emerged in continental southwestern China, but we do for sure know that the first cases emerged in Hong Kong. And the third plague pandemic was an airborne type of plague. It was not carried by droplets, it was not carried so much by bodily fluids as it was through airborne droplets. So it was in fact a very easily transmissible disease. And it emerged in Hong Kong in 1894. And Hong Kong then and now was a highly crowded, very large city. The city was populated at that time primarily by contract laborers, Chinese contract laborers who were brought to Hong Kong by the British during the era of British colonial rule, to over 200,000 laborers who are crowded into very makeshift housing conditions with virtually no sanitation, very poor nutrition, and almost no hospitals who were available to the residents of the city at that time. In fact, there were only 2 hospitals in the entire city of Hong Kong, including one that was reserved for women, women who are primarily involved in long-term partnerships with European and British men at that time, had an entire hospital that was devoted to them. And then the other one was primarily for Europeans. So there was almost no public health infrastructure in Hong Kong at that time. even though the city had grown to be really an enormous city. In fact, at that time, Hong Kong had a greater amount of trade going in and out of its port compared even to London. So Hong Kong was just a major international trading port at that time. So when this highly infectious airborne disease hit the workers of Hong Kong, not only were they very vulnerable, and I apologize for the graphic nature of some of these images. I hope it is quite disturbing, in fact, and it's disturbing because this was, of course, one of the most well-developed and wealthy empires of all world history, and they didn't have anything approaching medical care or hospitalization facilities for their workers. So it's really quite telling that the British Empire had not really put any degree of investment into its medical infrastructure. So when the plague hit Hong Kong, there was literally no place for people to go except for very makeshift facilities, which were kind of hastily thrown together by the British. In this case, they converted a former glass works into hospital grounds for people who had been infected by the plague. So it was really a quite shameful moment of an absence of public health infrastructure on behalf of the British colony. And it also happened to hit during the Lunar New Year celebrations, which was, of course, a time when many people were traveling. And that also helped to spread the disease very quickly because, people were just moving around quite a bit, going back to the continental China and other parts of Asia. So that also spread the disease. We know that the disease was, in fact, bubonic plague because a ship's doctor at that time, his name was Alexander Yersin. He was a Swiss scientist. He was a ship's doctor in Hong Kong, and he actually procured samples from plague victims and did some work on those samples with his microscope on the and based on his findings, was able to identify that it was in fact a bacterium that was causing the disease. So the plague bacterium to this day is named after Alexander Yersin. It is in fact Y. pestis to this day. So how did the British respond then to this terrible outbreak of plague? They responded through incinerating workers' housing and possessions, which of course is an incredibly brutal way to take care of a plague infection. Plague is primarily transmitted either through airborne particles or also through body lice and fleas and these kinds of things. So they thought by burning the housing, they would take care of the plague. Of course, what we know now is that crowded living conditions themselves are a much higher driver of an airborne disease infection. What you do with the houses really doesn't do much in terms of plague control. They didn't know that at that point. But we know now that this was a particularly, not just a very, brutal way of dealing with a plague, but also a pretty ineffective way of dealing with the plague as well. So going forward, the next major city to undergo a plague outbreak was Honolulu. And of course, at that time, Hawaii was a US territory. It was not a state. And it's not too surprising that some of the plague prevention measures that were used in Honolulu, in fact, are quite similar to what was done in colonial contexts, including Hong Kong. So when the disease was identified in Hawaii, there were 5 residents of Honolulu Chinatown who initially died of plague in 1899. The Honolulu Board of Health proceeded to quarantine about 14 blocks of Chinatown, and that was at that time home to about 10,000 people. So the residents of Chinatown were in fact blocked from not only their homes, but they were also blocked from the harbor, which was a particular hardship to people who relied on being able to access the harbor and to access fish in the harbor for themselves and for their families' nutrition. And it was also a particular hardship for day laborers who were prevented from being able to seek work. So it was not only a hardship losing your housing, it also meant losing food sources, and it also meant losing their employment. So the Board of Health, their procedures in terms of dealing with Hong Kong were quite intense and quite difficult for the residents to deal with as well. They also had kind of public disinfection campaigns. This is an image of Japanese men being asked to take showers in public in order to ensure that they were meeting kind of sanitation guidelines and so forth. And as another thing that I think is rather an echo of the situation in Hawaii over the past couple of years, there was also discussion about limiting trade and tourism in and out of Hawaii, but ultimately the decision was that as much as possible, trade and tourism should be allowed to continue throughout the epidemic. So in addition to quarantining Honolulu, the Board of Health also decided to follow British public health practice, which was to burn selected buildings. Fire was used, and that was also done in Manila as well. In the Philippines, there was also an outbreak of airborne pneumonic plague. But this is an image of Chinatown under fire. And I think many of us also will be familiar with the Great Fire as it occurred in January 1900, when a fire that was ordered by the Board of Health escaped out of control and burned almost all of Beretania Street here in Honolulu, which left about 8,000 to 10,000 people homeless, among them primarily Hawaiian, Chinese, and Japanese residents of the city. So the third area I want to look at in terms of our comparison of the third great plague pandemic is in Manchuria. So after the outbreak in Honolulu, the next great outbreak was in Northeast Asia, at a time when that area was very much engulfed by a struggle for control between China, between Russia, and also a relative newcomer to colonialism and to continental Asia and that part of the world, namely Japan. Japan, of course, had developed quite quickly after the Meiji era began in 1868. They embarked on a period of rapid industrialization and westernization, and public health was a really significant part of the kind of Meiji modernization program, including adopting Western germ theory, adopting kind of Western notions of hygiene. And so the Japanese approach to their colonial territories was that they really wanted to highlight their expertise in dealing with public health issues, including epidemics and infectious disease. So the first outbreak of pneumonic plague in Manchuria occurred along the Trans-Siberian Railway. The railway was largely built with the cooperation of Russia and China, but then after the 1905 Russo-Japanese War, Japan had been taking over the administration of the railroad as part of their settlement with Russia. And the first kind of station on the railway which saw a plague outbreak was Manjoli, way in the northwest corner of Manchuria. And very quickly, the disease spread along the railway line. So again, then as now, it's really highly trafficked parts of the world, large port cities like Hong Kong and Honolulu, or in the case of Manchuria, a part of the world with a very comprehensive and rapid train network, right, brought the disease from station to station. This is also something that you see in the 1918 flu pandemic in many parts of the world. You can actually trace the presence of the disease along railway lines. Very quickly, the outbreak killed over 60,000 people in Manchuria. It wiped out entire villages and towns, and almost all of the plague victims in colonial Manchuria were in fact Chinese. And there's some speculation about why Chinese victims were particularly prevalent, but again, a lot of it has to do with crowded living conditions, poor nutrition, and other ways in which just low public health services in general. As in Hong Kong, and to some extent as perhaps in Honolulu, people were faced with quarantine and with very strict measures, kind of very intrusive public health measures on the part of the Japanese colonial authorities. And what people tend to do, or what people tended to do at that time, if they were faced with a quarantine that prevented them from working, they had to flee the quarantine because there was really no choice there. If you were locked in and could not support yourselves, you would leave. And so there was a lot of flight in Manchuria. From a public health perspective, however, you don't want to see people fleeing who are carriers of an infectious disease, because they will then go ahead and transmit that disease to other people. But what they were asked to do if they were left behind in Manchuria was very, very difficult. So public health measures included, for example, having people be quarantined in railway cars, and things that were really quite difficult for them to handle. So from the Chinese perspective, the main concern, or one of the main concerns, not only was the progress of the disease, but also the potential for it to serve as a pretext for further colonial occupation of Northeast China, either by Russia or by Japan or by another colonial regime. And the concern was that if China could be said to not be handling the disease appropriately in areas under their control, that would be a pretext for greater kind of colonial pressure or stationing more troops and so forth, effectively ceding sovereignty even more to Japan and other colonial forces. So the Chinese government brought in Dr. Wu Liande, who was himself a Malaysian-born Chinese. He had studied medicine at Cambridge University in the UK and also trained with Karl Frankl, who himself had been formerly an assistant to the Nobel Prize winner Robert Koch. So he came from a very distinguished kind of lineage, so to speak, of bacteriologists, including the person who had discovered the TB bacterium and some other really important kind of innovations. So Dr. Wu was sent to Manchuria in order to take over. He, in fact, proved that the disease was pneumonic plague, namely airborne, rather than bubonic plague, which would have been conveyed largely through lice and fleas. And so basically, he proved that it was spread via human-to-human contact in an aerosol form, as of course we're familiar today with COVID. He also produced practices of performing autopsies, which was fairly unusual in China at that time. And then he did, in fact, impose public health measures, including lockdown and placing infected patients into isolation. He also set up, patrols on horseback, in fact, to round up corpses and to burn them safely. But probably the innovation that Dr. Wu is best known for, and which remains one of the great public health innovations of the past century, is the fact that he developed an inexpensive and highly effective form of cotton face covering. These were not, strictly speaking, these were not surgical masks. Masks had been used in surgical procedures for several centuries prior to this, but they were not typically used in other settings. They were not used by either by non-medical personnel or even by medical personnel outside of an operating room. So this was really Dr. Wu's major innovation, was to insist that all of the public health personnel and anybody who is going to come in contact with, anyone who might have plague, be required to wear a cotton face covering. And they were very, very thick, as you can see, many, many layers of cotton gauze, and also with a very innovative kind of tying process in the back, so that even in the frigid, cold, and windy Manchurian winter, these face coverings would stay on. And here's a photo of Chinese public health officials and staff at that time wearing these face coverings that Dr. Wu had, in fact, invented. What Dr. Wu said himself was that he thought the masks were the face coverings were clearly efficacious in terms of preventing the transmission of an airborne disease, but people were in fact quite skeptical in the international medical community. So one of the French public health officials who had been sent to the area, his name was Gérald Mesny, in fact refused to wear face coverings outside of the surgical theater because he felt that they were no evidence, that they were of any use. So Dr. Mesny went to a hospital without wearing a face covering and himself died of plague. So Dr. Wu himself wrote in his memoir that he thought the reluctance on the part of the international medical community to trust his science on the efficacy of face coverings was in part because he was Chinese, and he felt that had it come from a European doctor, it might very well have been better received by his colleagues in Europe and in other parts of the world. Another thing that came up in the Manchurian plague, which I thought was very interesting, is that there was a lot of concern over how different religious communities might deal with the fact that they were being asked to not gather, right, to not have religious, to not have meetings in churches and in other places. And in fact, this was a problem in Manchuria. Although notably, the Islamic community in Manchuria did very well with the plague, partly because they established their own quarantine procedures and prevention societies, and also set up charitable associations to provide financial support for Muslims who were driven to poverty due to the epidemic. After the plague was brought under control, Dr. Wu proceeded to set up a long-term plague station in Harbin. They had international conferences in Harbin and other places to kind of celebrate and talk about the successes of containing the pneumonic plague in 1911. And this also really kick-started the rise of what we might think of as modern public health in China. New hospitals being established, new medical schools being established, and also vaccination campaigns getting a lot of attention and support in China, and really, kind of a very robust public health response. And of course, the history of modern China ever since has to a large extent been the history of a very well coordinated, vertically integrated public health response, including in the period of the People's Republic. And of course, in Taiwan as well, we've seen an extraordinary public health response to COVID-19. So I think Taiwan is also an example of a very successful Chinese public health response to COVID. So I just wanted to get back to one thing that I wanted to point out. I mean, I think it should be fairly clear from my talk, or at least I hope one of the things that has come through in my talk today is that the progression of illnesses then and today is really not entirely absent or not entirely independent of the kind of political and the public health situation that's present in any given place, right? One of the reasons why certain diseases spread very quickly at that time in those three parts of the world is because those three parts of the world had fairly immature public health infrastructures, whether because they didn't have the degree of investment that we would have expected, or because of other kind of elements of their political and administrative situation. So I think one of the messages is that public health is an ongoing and very pressing issue. And certainly that it has been and continues to be very much a global issue, right? Diseases emerge in multiple parts of the world and they tend to spread very quickly. It's very difficult to say with any confidence where a disease actually originates, because an infectious disease, particularly an airborne infectious disease, can travel very quickly and can also kind of be dormant in certain parts of the world for quite a long time before they emerge. So we are connected, we have been connected, and it's really a question of making sure that we have a kind of, efficient public health response that is, that is robust and is also based on the science and is based on, is based on good community support as well. So those are some of the things that I feel like I've learned from looking back at the pneumonic plague of 1894 to 1911. I would be very glad to know of your questions. And I can also show any slides again if anybody wanted to look at any of the images in greater detail. So thank you.